Okay, so these are the top 10 triage questions in Spanish. If this is too boring, please let me know. If you need more animations or something, just let me know down there in the comments. Please, I'm trying to improve the videos. So let's get started. Okay, so these are the top 10 triage questions in Spanish. What seems to be the problem today? In Spanish, that's ¿Cuál parece ser el problema hoy? If this is too long, I have another option for you. You can just ask ¿Cuál es el problema? Maybe that's a little bit easier for you. The second one, how severe is your pain from a scale from 0 to 10? ¿Qué tan severo es su dolor en una escala del 0 al 10? If that's a mouthful, you can use the second option. Maybe it's a little bit easier for you. Here we go. Del 0 al 10, and then comma, ¿qué tan severo es su dolor? From 0 to 10, how severe is your pain? Now, if this is still a little too long for your taste, you can just ask su dolor del 0 al 10, which means, your pain from 0 to 10. A little bit more short, but you still sound respectful and straight to the point. Now, do you have any difficulty breathing? This is one that comes across very often. Tiene dificultad para respirar. Tiene dificultad para respirar. Do you have difficulty breathing? If that's too long, le cuesta trabajo respirar, which is Spanish for do you struggle, do you work hard to breathe? Le cuesta trabajo respirar. A lot of times you will also hear patients say, me cuesta trabajo respirar. That's what they mean. Es difícil respirar, a little bit shorter. It's hard to breathe. Es difícil respirar. And then, have you had any recent trauma or injuries? This can be a mouthful. ¿Ha tenido algún traumatismo? That's a long word. O lesiones recientes. ¿Ha tenido algún traumatismo o lesiones recientes? Now, if you don't like that one, or it's a little bit too long, se ha lastimado recientemente. Have you hurt yourself recently? Se ha lastimado recientemente. If that's still too long, you can just ask very simple and still get the context. ¿Alguna lesión? Any injury? ¿Alguna lesión? Now, are you currently taking any medications? A favorite one. ¿Está tomando algún medicamento actualmente? That's the long form. That's literally the Spanish version of what you just saw in English. ¿Está tomando algún medicamento actualmente? If that's too long, here we go. ¿Está tomando medicina? And I would like to make the distinction here. You're going to hear medication and medicine almost used interchangeably in Spanish among patients. Medicamento, medicina, they mean their medicine. Of course, you know the difference. Medicine has to do with the branch. Medicamento is medication. Now this one. ¿Tiene antecedentes de alguna enfermedad crónica? ¿Tiene antecedentes de alguna enfermedad crónica? You're asking about the medical history here. If that's too long, this is another way that I like to ask about it. ¿Tiene problemas crónicos? Do you have any chronic problems? Now, the word chronic may be too hard for some of your patients. So you can ask it like this. ¿Tiene historial clínico? Very simple. Do you have medical history? ¿Tiene historial clínico? Clinical history. If that's still not cutting it, ¿tiene alguna enfermedad? Do you have any disease? A lot of the times patients will refer to their history as have this type of disease, sickness. Have you traveled internationally or a long time recently? ¿Ha viajado internacionalmente recientemente? That's a mouthful. Here's a better way of asking it if that's too hard for you. If you're asking it like that, that's perfectly fine. ¿Ha viajado internacionalmente recientemente? They will understand you. But if it's too hard for you, you can say, ¿viajó en auto por más de 2 horas? Did you travel by car for more than 2 hours? That's a common way of asking it. ¿Viajó en auto por más de 2 horas? If that's still a mouthful, you can say, ¿algún viaje largo últimamente? Lately, any long journey? ¿Algún viaje largo últimamente? Are you allergic to any medications or substances? Here we go. Es alérgico if it's a male, or alérgica if it's a female. Algún medicamento o sustancia. Algún medicamento o sustancia. Are you allergic to any medication or substance? Now, that can be a mouthful for some of you, so you can ask it like this as well. ¿Tiene alguna alergia? ¿Tiene alguna alergia? Do you have any allergy? Do you have any allergy? ¿Tiene alguna alergia? Or you can simply ask, ¿tiene alergias? Do you have allergies? ¿Tiene alergias? If this is helpful, please let me know down there in the comment section. Do you have numbness or tingling? ¿Tiene entumecimiento u hormigueo? I made a mistake there. It should be a U, because every time you have an O word or O sound, you put a U instead of an O for or. ¿Tiene entumecimiento u hormigueo? If that's too hard for your patient to understand, sometimes it is. ¿Siente dormido o hormiguitas? Do you feel asleep or little ants? ¿Siente dormido u hormiguitas? That should be simple for them to understand. Are you pregnant or could you be pregnant? Another favorite. ¿Está embarazada o podría estarlo? ¿Está embarazada o podría estarlo? You can also ask posibilidades de embarazo, pregnancy possibilities. Very straight to the point, very respectful. You're not rushing it. Posibilidades de embarazo, they will say either yes or no, and you can follow up with the next question. I hope this is helpful. I'm trying to pump a video a day. If it's too boring, let me know. If I need to add something or subtract something, let me know. I'm new at this and I can use the help. Thank you very much.